and welcome to an introductory lecture on LSVT Big by LSVT Global. My name is Jenny Tocito. I am a physical therapist. I am also part of the LSVT Big training and certification faculty and currently serving as the Director of Innovation and Communications for LSVT Global. And I will be taking you through this lecture today. First, we're going to start with just a little bit of background on what LSVT is, where we came from, how we have come so far to exist as the company that we are today, and the treatments that we provide today. So first, a little introduction to what LSVT Big results look like. I'm going to share a case study of a client whose name was Bernie. Bernie was 71 years old at the time of these videos. He had had Parkinson's disease for 14 years prior to receiving LSVT Big treatment. He was actually referred for therapy because he was demonstrating some slowness and difficulty with walking. He was having some issues with falls and was also reporting problems related to freezing. He has optimized on his Parkinson's medications, both in the pre and the post videos, meaning there's been no changes to his medications. The changes that you see are exclusively a result of his therapy and home exercise that he was completing. And as far as the Hone and Yar scale, which is a scale that physicians and medical providers often use to rate the level of severity of the current diagnosis of Parkinson's disease, he was at a Hone and Yar stage 3. So this video doesn't have any sound. You're just going to see a side-by-side demonstration, and I'll talk you through it a little bit here as we go. So on the left side of your screen, you're going to see pre-treatment. So this is before he underwent LSVT Big treatment. And on the right, you're going to see post-treatment, which means after 4 weeks of LSVT Big. On the left, you can see he's using a cane. He's having some freezing as he's approaching that doorway, the rug, some of the flooring changes that he's encountered. On the right, you can see he no longer is using a cane. He's all the way out in the parking lot already, taking longer steps. He's got more of an arm swing and definitely more confidence with his walking. On the left, you can see his wife is staying rather close to him. On the right, he's already walked past his car, turned around, and is coming back. So I hope you can see, as I do, that there's been some significant changes in his walking ability. There you're starting to see a little bit of slowing down of those steps as he approached the car, which could lead into some freezing. And on the right-hand side, he is just continuing to walk away. So where did we begin? How did we get to be where we are today with the treatments of LSVT Loud and LSVT Big? Well, if you ever wondered what LSVT means, it is named after a woman by the name of Lee Silverman. So the LSVT stands for Lee Silverman Voice Treatment. And the reason why it was named after her is her family invested some initial money into the research of determining what could be done to help understand her, to be able to hear and understand her better. So Dr. Lorraine Ramig in Arizona began looking into a treatment that could help with volume and legibility of voice. That was over 30 years ago. You can see that initial intervention data came from the Lee Silverman Center in Scottsdale, Arizona between 1987 and 1989. And then it went on to receive grant funding for ongoing research from that time, where they had multiple randomized controlled trials published, which is the highest level of evidence that you can have in research. And you can see in the early 2000s, that's when LSVT Big came about. So all the research prior to that was on LSVT Loud, which is the speech version of the treatment. And then when LSVT Big treatment came around, that was the translation of the treatment over to movement. So your ability to do functional activities, walking, all of those kinds of things. Starting in the early 2000s, the first LSVT Big certification course to teach therapists how to deliver the treatment was in 2007. And then we've continued on with research and investigation from that point forward to where we are today. And where we are today as a company is that we have a global mission to empower people living with Parkinson's or other diagnoses to restore and maintain their highest levels of functional communication, mobility, and independence in daily life through the scientifically supported treatment programs of LSVT Loud, which is speech therapy, and LSVT Big, which is physical and occupational therapy. In this lecture, we're going to focus on the LSVT Big side of things. So, what is LSVT Big treatment? Well, it is an intensive, amplitude focused physical and occupational therapy. It was initially developed for Parkinson's disease, but since that time, we've seen expansion into a variety of other diagnoses, along with published literature in a variety of diagnoses. It is a standardized 1 month of treatment. So we see patients, our clients in the clinic, in their home, in whatever therapy environment works best. And we see them for 1 month with 4 times a week for 4 weeks of treatment. We customize the functional portions of the treatment session to each individual goals of that person. And the exercises and treatment techniques can be adapted to make them a little easier for people where maybe the standard is too difficult or a balance is too impaired. And it can also be progressed to meet people's level if they're just early in their diagnosis and need to be challenged more than just the standard set of exercises and activities. So your therapist knows how to adapt those exercises and functional techniques to meet you where you're at. Because we like to say that it is never too late to start. The earlier the better with getting involved in LSVT Big treatment, but it is never too late. Our overall goal is to restore normal movement patterns in everyday activities. So, those things that have become more challenging, we want those things to again become easier and feel more normal for you. There's a few fundamentals of LSVT Big that we're going to touch on. The first is that we have a single target, and our target is amplitude. So the word big comes to mean increased amplitude across exercise, functional tasks, walking, anything you can think of that's a single focus of putting on your amplitude glasses and looking at everything through the idea of bigness. Then the mode is the way in which we deliver treatment. Mode is intensive with high effort, meaning that we see clients frequently. And during those treatment sessions, we ask for our clients to work at a level that is challenging for them. We know from the research on Parkinson's disease the importance of exercise and also tailoring that exercise to ensure that people are being challenged by what they are doing. The other piece is that we want to achieve calibration. So we want generalization to daily functional activities, meaning that we don't want you to always have to think about doing things bigger. We'd like for you to get to the point where you feel like you can do these things without having to think about that, and you can do them more normally again. So part of that is retraining that sensory system, that internal cueing system, to know and accept that increased amplitude is necessary and that actually using that increased amplitude returns things to a more normal level. The other piece is those neuropsychological changes is that you are able to know and accept that I just need to move this way to be perceived as moving better and not only by yourself, but by others around you. And addressing those issues related to lack of activity, apathy, depression, other things that could come with the diagnosis of Parkinson's through becoming active with exercise. Our single target, as I mentioned, is big. So that Q of big means large amplitude, whole body movements. What happens in Parkinson's is that because of the changes with dopamine in the body, that people begin moving smaller and slower than they intend to move. So what happens is you might see that more stooped posture, decreased stride length and steps, decreased arm swing, as an example with walking. And then we want to drive effort to bigger amplitude to override those issues with that small and slow movement so that we can gain the idea of a healthy amplitude of movement, which is through that cue of big. So longer steps, bigger arm swings, and trying to restore that more upright, tall posture that is typical. The mode of delivery then is the next piece where you are treated by a physical or occupational therapist. They must be certified in LSVT Big. And it is a one-on-one therapy intervention, which means that it is not a group, it's not a group exercise class. And in fact, the exercises are only one small portion of your individualized treatment session. So you will meet one on one with your therapist 4 times a week for 4 weeks, which means there's 16 visits in 1 month. The sessions are 1 hour in length. You are going to do a variety of exercises, functional tasks, and walking in those sessions. And then you're going to have homework. And that homework includes daily carryover assignments where we give you something to do with large amplitude every day of the month, as well as homework. The homework is really just an abbreviated version of what you do in the treatment session. So it's not a full hour of additional exercise at home. It's an abbreviated version that should only really take you about 15 to 20 minutes a day of exercise. And then our goal is that idea of calibration, that we address that issue with the mismatch between your perception of your motor output and how others perceive it. Meaning, it may feel like you're moving how you should move, but when you look at yourself on film or you have family or friends that comment on it, they see that you're moving smaller than you should be. And then when you're cued to move bigger, it might feel abnormal to you until your body and your system adapts to it. So here's a couple of quotes from clients that had went through LSVT big treatment. The first one is, I had no idea how small my world had become. I can't move like this. People will think I'm crazy. So that idea that it feels like you're moving so much bigger, but when you look at it on video or family or friends comment, they can actually see that you're moving more normally. And your therapist can use things like videotaping, other kinds of feedback to help show that to you as well, so that your body adapts and understands what it needs to do. With our end goal of being the fact that you can use your bigger movements more automatically in your daily life and you can maintain those bigger movements over time. So that goal is to return to more of a normal way of moving and be able to sustain it. This is what an LSVT big treatment session generally looks like. So we do 7 different exercises. We call them maximal daily exercises. As you can see, there's anywhere from 8 to 10 repetitions of each one. We then shift over to what I like to call the functional portion of the treatment session. Functional component tasks are simple one-step tasks. We do 5 of them and we practice 5 reps of each of those every day. Some examples might be standing up out of a chair, pulling your keys out of your pocket, reaching to grab something in the refrigerator, opening a door, something that's simple, just a one-step task that doesn't take a lot of time that you do commonly. And then the hierarchy tasks are things like getting out of bed, playing golf, getting in and out of a car, taking a shower. Think about things that take multiple steps to complete. So, for example, if you need to go take a shower, you have to deal with your clothing, you have to get clothing off, you have to get into the shower or the tub, you need to turn the water on, you need to get shampoo and conditioner out of your bottles. You need to scrub your hair. You need to dry off when you're done and get dressed again. So, as you can see, it's a complex task, and we call those hierarchy tasks, where there's a lot of different steps to complete that actual task. And then the last piece is big walking. And we practice walking big in a variety of environments, a variety of distances, depending on the day, the time, and the environment we're working on. So all of these things related to function are help you help to design. What we want them to be salient to you, and what that means is that there are things that are important to you, things that you want to work on and get better at. So, just to keep that in mind, that you work with your therapist on identifying those tasks and building the functional portion of your treatment session. I'm going to take you through and show you a little bit about what the exercises look like so you have an idea of what you would be doing with those exercises. So there's two that are typically done in sitting. The first one is floor to ceiling, the second one is side to side. These are both completed with a 10-second hold in the positions that you see here in the picture. They're the only two of the 7 exercises that have that hold time to them. So we like to call these the sustained movements, where you actually practice holding a position. In this video, you're going to actually see some repetitions of what those exercises look like.
Let's start with your big posture. Watch Jenny and do what she does. We're going to reach out big, down to the floor, up to the ceiling, back big. And now hold. And we're going to hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and finish big. This is your second sustained exercise, the side to side reach. And start again with your big posture. You're going to reach across your body as far as you can. Really use your leg to reach even further now. Good. Now we're going to hold that big reach for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And now finish big.
So you would practice that side to side exercise to both sides. Sometimes we do one side at a time. Sometimes we alternate sides. And then you'd move on to doing the standing exercises, which we refer to as the repetitive movements. And these first 3, you can see you step in a forward direction, a sideways direction, and a backwards direction. And these are being shown in their standard format. They can also be done holding on to something on one or both sides. They can be done in sitting or even in lying down in case that is the most appropriate position for you at that moment in time. So we're going to watch a little video here of what each of those look like.
I'm going to have you watch Jenny and do what she does, and she'll model the exercise first, and then we'll practice. Be sure and start with your big posture, and you're going to step forward, open up big, step back big. The next exercise is the step to the side and reach. You're going to step to the side big with big arms, and then come back and finish big. Our next exercise is the step backwards and reach. You want to be sure to start with your big posture, and you're going to have big hands, and then we're going to do a nice big step back, big arm movements, and then come back and finish big.
So then there are 2 more exercises that we complete, and those are considered the forward rock and reach and the sideways rock and reach. So they're more of a repetitive flow from one position to the next. And here's a video that'll show you what those look like.
You want to start with your feet in a big posture. Big step forward and nice and big and wide. Now you're going to begin to rock forward and backwards with a big rocking motion as you go. Now let's begin to add your arms. So big reach, big rock, big reach, big rock. Now we're going to switch your feet and we'll do the exercise again. So put your other foot forward, big step, nice and wide. And we're going to begin to rock back and forth big. Add your arms, get your movement going, and we'll start the count now.
So beyond the exercises, we're going to work on those functional parts of the treatment session. The first is those simple one-step tasks that we call functional component tasks. And one of them is always going to be sit to stand. So we'll watch a video of that in a moment. But here are some other ideas of functional tasks that people have reported that they want to work on. And again, realize you're not picking from a list here. You are truly identifying things that you have noted that you need to work on. And then your therapist is designing your treatment protocol based on what your specific needs are. But here is an example of what the sit to stand looks like and practicing that in your therapy session with big amplitude.
Reach big, up big, reach back big, and down.
And you would practice that repetitively 5 times in every session. And then you would also practice that at home. That other piece then is the more complex tasks, we called it. We like to use this fancy word of hierarchical tasks, which is a mouthful. But really, they are complex tasks that you practice throughout your weeks of treatment. These are going to be those things that we mentioned, like getting out of bed, going to the bathroom, taking a shower, getting in and out of the car. Maybe it's social activities you do on a very regular basis, such as playing cards with friends, playing tennis, biking, golfing, anything you can think of where there's a lot of different activities. We choose anywhere from 1 to 3 more complex tasks, and we practice those in every session as well. The last piece of the treatment session is that we work on big walking. And big walking could be done in a small space inside your home or inside a treatment space, or it could be done outdoors in hallways. And we try to have some variety to the practice so that you get a chance to practice using that increased amplitude, both in large open spaces and in small, more confined spaces. Here you're going to watch Tammy. She is this patient's therapist, and she's going to be giving him some cueing on walking with his big steps and big arm swings.
Okay, so Jerry, I'm going to show you what I want you to do with walking big, okay? And then we'll do it together. So I want you to think about really pushing. Yeah, good. And then we're going to take a nice big turn, and I want you to really push. Good. Nice big turn. Let's go. Big posture. There it is. Good job, here. Good. Let's turn. Really big. Awesome. Okay. Let's do it again. And let's get this arm going. Yep. There you go. There you go. I kind of messed you up, didn't I? Okay. Swing that left one, Jerry. Lefty. Come on, lefty. Can you go any bigger? What do you think? Any bigger. Any bigger. Good. Nice big turn. Any bigger, Jerry? Let's go. Lots of effort. Good. How did that feel? Did it feel better? It does, doesn't it? Yeah. Okay, this time I want you to try one more time. I want you to give like a 10 out of 10 effort through your legs. Okay, so with that nice big push, you ready? Here we go. Nice big push. Nice big push. Big turn, Jerry. Big turn. There you go. Good. How did that feel? Didn't it? Okay, so that's what I want you doing when you're walking at home. What do you think about that big push on your legs? Okay, good.
So as you can see, he had a little more difficulty with swinging one arm versus the other. So Tammy was giving him some cues, trying to encourage that bigger swing. What about the research on LSVT Big? Well, we talked about this a little bit at the beginning, but in the history of LSVT Big, which again started in the mid 2000s, we have seen more than 30 studies published, including 3 reviews. We've seen 2 foundational randomized controlled trials, plus some other more recent ones that have been published too, and more than 5 studies on application to diagnoses beyond Parkinson's disease. One of my favorite studies that was done on LSVT Big was called, we like to call the Berlin study. So it was comparing exercise in Parkinson's disease, the Berlin LSVT Big study. This was done in 2000 or published in 2010 by Dr. George Ebersbach and his team. He sent some of his therapists he worked with to the United States to get trained in LSVT Big as soon as it was a new treatment. They came back and they started a study where they allocated 60 different people that were living with Parkinson's disease. 20 of them did LSVT Big, 20 of them did Nordic walking, and 20 of them did an assigned home exercise program. They all received 16 sessions of therapy. The LSVT Big group and the home exercise group, it was 4 times a week for 4 weeks. The Nordic walking group was actually twice a week for 8 weeks. And when we asked why they chose to do that, it was because that was pretty normal in Germany at that time to order twice a week Nordic walking. So they wanted to really compare apples to apples and look at what they were doing at that moment in time for treatment and how it compared to a more intensive treatment option. Here were their results, and I'll first tell you a little bit about what you're looking at. So what they use is called the UPDRS, which is the United Parkinson's Disease Rating Scale. Now, if you're someone living with Parkinson's disease, this may have been done with you and you really weren't widely aware of it. This could be something your neurologist is doing where they're testing and looking at your tremor, your ability to do rapid alternating movements, and a variety of different functional motor tasks that they might do in their evaluation. So we had the 3 groups. The solid line is the people that did the home exercise. The tiny dotted line is the people that did Nordic walking, and the wider slashes are the people that did LSVT Big. Now, a better score on the UPDRS is a lower score. So a drop in score is a positive change. You can see it started from right away at start of treatment, and they followed them out for 4 months or 16 weeks. By looking at this diagram, you can also see that the people that did LSVT Big were the only group that were able to improve on the UPDRS, and it was clinically significant. And even after the 4 weeks of one-on-one therapy intervention stopped, they still continued to improve further on their own with maintaining their home exercise practice and keeping up with their exercises. When I got a chance to meet Dr. Ebersbach, I was able to talk with him a little bit, and he shared with me what he found to be the most impressive of the study is that when they look to advance medications through clinical trials, they want to see a 5-point drop on the UPDRS to say that, hey, this medication is working and we want to advance it. And what they found in this study was a more than 5-point drop with exercise alone, really solidifying that idea that exercise is medicine and that LSVT Big was able to cause that change. They then did another study analyzing that data set where they looked at a randomized, or doing a different research study, I should say, where they looked at a randomized study comparing that traditional LSVT Big treatment to what they referred to as a short training protocol. What short training protocol meant is that instead of seeing patients 4 times a week, they saw them 5 times a week, still 1-hour sessions, but that time frame only lasted for 2 weeks. So they basically got 10 visits of treatment in 2 weeks' time. Now, if you look, you can see that in both groups, they improved, right? That we saw improvement from that short protocol and the LSVT Big protocol. And 70.6% of patients reported to be much improved or very much improved with traditional LSVT Big. So they did get better in both groups. But what is the hallmark difference? Well, the hallmark difference is that even though they could perform well on the tests after 2 weeks, the data suggested that they may not have been fully calibrated. And what we mean by calibrated is that we've laid down that more permanent brain change to allow people to sustain continuing at that functional level, even beyond when therapy concludes. So the results of the study still recommended the traditional 4 times a week, 4-week treatment protocol for LSVT Big when they concluded with their results. There's been a variety of other published articles that have looked at the cross-system effects of treatment, which basically mean all the other things that could improve as a result of LSVT big. So they have documented in research studies improvements in trunk rotation, stride length, speed of walking, speed of movement, reaction time. As we talked about in that last study, the UPDRS motor scale, balance, coordination, and ADLs, which is your activities of daily living, and dual tasking and occupational performance. So there has been a lot of other effects or changes that come from that simple cue of think big. In summary, these LSVT programs have been developed and studied over the past 30 years. LSVT Big is one type of physical and occupational therapy that has the potential to offer improvements in both movement and quality of life for people with Parkinson's disease. A quote from a former client of LSVT Big and LSVT Loud, Sharon Kaw, said, "It is possible to take charge of your life even with Parkinson's. It is possible for your will to override your brain. It is possible to have power over Parkinson's." And then I want to leave you with one more video just so you can hear from a few people in their own words what doing LSVT treatment has meant to them. Here's a little bit of information and advice from Margie, Leon, and Gary.
First of all, I want to say that I also take on this mindset that exercise is my primary medication. Levodopa helps, yes it does, but I think of exercise as being my primary medication.
So I'm actually in the best shape of my life, deteriorating neurological condition aside, and it's phenomenal. It really is. I'm not cured, but I am better.
Right now I believe that if I keep working harder and harder, I'm going to get better and better. I believe that, I believe that I won't go downhill.
We may only have one thing in common, basically, and that's Parkinson's. But that commonality has brought us together on so many different levels, and it's heartwarming.
So if you're interested in learning more, we have a wide variety of opportunities for you to learn more. Our website, which is our front-facing lsvtglobal.com website, has a wide variety of information. You can look at what is LSVT Big. If you're a therapist or professional looking into getting certified and doing the training, there's a whole section there that you can look at too. And then what we kind of refer to as our backside of our website, which is accessed through our blog at the top of the main website or by the link on the slide below, houses a lot of different things too. It hosts where our live and on-demand webinars live, which are all free resources for people. We post blog posts, testimonials, and videos, research on LSVT Big, lots of information that you can find there. And if you'd like to see what we're up to, what we're doing, what's new, follow us on Facebook, Instagram, Twitter, YouTube, and or LinkedIn. We would love to have you stay up to date on all things LSVT. Thank you so much for listening and spending your time with me. If you have any follow-up questions, visit our website. You can also call us at the number listed below that. And if you have questions you want to ask directly, email us at info@lsvtglobal.com, and we will be happy to get a response back to you or assist you in finding a clinician near you, which you can also do on that lsvtglobal.com website. We have a tool there, a search tool where you can click Find LSVT Clinicians, enter where you live, and look for therapists in your area. Thank you, and have a wonderful rest of your day.